Hello everybody. We are discussing anatomy and this is the first class for anatomy. Basically when we say anatomy, we can approach anatomy in two different ways. First one is grossly and the next one is microscopically. Anatomy, one is grossly and the next one is microscopically. Microscopically. When we say grossly, that means without the aid of magnification. Generally, when we say anatomy, we mean gross anatomy. And the another name for gross anatomy is macroscopic anatomy. Let me write it. Grossly, no aid of magnification. Typically, anatomy means gross anatomy, and the another name for gross anatomy is macroscopic anatomy. Okay, let's go to the next approach of study of anatomy, microscopically. So what is microscopically? It's clear, it's the study of structure with the aid of microscope, and it is microanatomy, or the another name for it is histology. Okay, let me write it. There is with the aid of magnification, and this is other name is microscopic anatomy or histology. Dear friends, I recommend that you can use pencil and write some of the points from here, because that may be helpful for you in future. Okay, so from where the term anatomy is derived? The term anatomy is derived from the Greek word temnen, which means to cut. Okay, let's see. Greek word temnen, which means to cut. This is Greek word. Okay, so now we know anatomy, gross anatomy, microscopic anatomy. Now when we have to study anatomy, there are different approaches, but basically there are two approaches. One is regional approach and the next one is systemic approach. Regional approach means you study anatomy of the body part by part. Like you first take thorax. If you take thorax, you study every part related to the thorax, like nerves, muscles, bones, etc. And systemic approach of study of anatomy means when you take system, you take only one system. If you take nervous system, you study the nerves and the other parts related to the nervous system only throughout the body. If you take the cardiovascular system, you take the blood vessels and the heart only, but throughout the body. Okay, so basically there are two approaches for the study of anatomy. One is regional approach, and next one is systemic approach. Okay, dear friends, because this is the first lecture on the anatomy, I'm just discussing the general things, okay? And more important things, they are coming in the next episodes. Okay, now let's see the nomenclature in the anatomy. You know, many words they are derived from Greek and Latin. They were given almost like 2000 years ago. And these words they are derived from the names of the common plants, animals, and some are even the name after the instruments, and some are even after the names of the warlike environment during the Rome and Greek. Okay, the Greek and Latin terms, the Greek and Latin terms, they were derived like some 2000 years ago. Okay, that's too old. And they are derived from the name after the name of the common plants and animals. Okay, I want to give some example, like Burmese. Burmese. What does the word Burmese mean? Burmese means, it's home, right? Okay, we have like cochlea. Cochlea means snail cell. Like what we other have, we have like Burmese, cochlea, and uvula. Uvula, it means little grapes. It's plant, right? Little grapes. And we have the cancer. Cancer itself is like crab. And the next is like muscles. Yeah, muscle is derived from the word musculus. Musculus, which means what? Mouse. Okay, some are derived from name of the animals like these things, and these things. Some are derived from the name after animals and plants. Okay, these things. Okay, let me discuss further. During the wartime, in the history, during the wartime between the Rome and Greek, scientists, they were like, the people were still like, they were giving the names, they were continuing giving the names. Let me take the some words and the terms related to wars, because they never stop giving names, right? Okay, it's not like simple name, thyroid. Oh, thyroid. What does it? What? Where does it came from? It came from this thing, seal. Its name means seal, like sealed. And G-force. What's G-force? G-force means sword. And there are like thorax. Thorax means like breastplate. Okay, there are even other names which are derived from like instruments. Instruments are like blacksmith related things like anvil, malleus, right? And this tympanum. Tympanum. Tympanum means eardrum, right? And this actually came from this word, drum. Tympanum means drum. Okay, now let's see some singular, plural, and then examples, right? When we are studying anatomy, it's not like the singular and plural form. It's not all of them are like common English, like adding es or s after the singular word. There is some, of course, there is some difference. Okay, let's see. Okay, singular ending, and then plural ending. Okay, let me create some space. Plural ending. And then let us take some examples. Do you remember the words that ends in A, the singular word, and its plural words ends at AE? Do you remember the word like papilla, whose plural form is papilli? And even the next one like axilla, which plural form is axillae. There are other words as well, like which ends at singular word, they ends at en and the plural ina. Sorry. The singular word which ends in ina and the plural words which end in like foramina is the singular and its plural form is foramen. And then lumina, whose plural form is lumen. Okay. Do you remember the words like which ends in es and the plural form ends in is? Okay, so it is testes. Testes is singular and then testis is plural. And then there are other words like singular word which ends in ex and the plural words ends in ics, like cortex. This is singular and then cortices. This is plural. And still there are other words like which ends on on and the plural form ends in a, like mitochondria. Mitochondria is the singular and the plural form is mitochondria. Okay, there are other words like which ends in and again it ends in the plural form ends in a, like epithelium. Epithelium, next is like epithelia. Okay. There are few examples which I give about the singular ending of the anatomic terms and plural endings and some examples, right? Okay. Actually, what I give lecture is just to provide the outline about the course, which, like for example, I give the lecture about anatomy, right? It is the basic, very very basic thing which students must know. And for other things, the students are supposed to consult the other books, like there are like Gray's Anatomy, Snell's Clinical Anatomy. And for South Asian people mostly use BD Chaurasia, and there are other like review things, sleeping cots and other things. For me, the lecture what I give is like very basic things, which you must remember. Okay, so my lecture is just like up to the point. Okay, we'll see about that. I can insist that you better make note of my lecture. Okay. Okay, let's see now anatomical position, because you know when you need to study like anatomy, okay, you need to see the body, right? So which is right? Do you consider right when you are standing like this, or you consider right when your back is in the front, or this way, or this way? So there should be some, to avoid the confusion. So which is dorsal, which is ventral, which is lateral, which is medial, right? To study all these things, we need to take the body in some standard position, and that position is called anatomical position. Okay, let us see. Let me describe it with a simple, very simple diagram. Okay, anatomical position. Anatomical position. Okay, let me make some sort of funny type of diagram. This is eye, nose, facial expression, this guy hand. Okay. Okay, it's very much random diagram. Okay, let's see. The first thing, hands. Hands are on side, right? Legs are together. Okay, let's see this part. Okay, let me here. Okay, let me draw it a little bit down. Okay, eyes are open. Eyes are open. Neutral facial expression, right? Neutral facial expression. You are not supposed to like laugh or become sad and these things like, right? Neutral facial expression, because most of the time when we study anatomy, the body part, we study on the cadaver, right? So there is almost no facial expression. And this thing, the lower orbit of eye, lower orbit of eye, okay, eye should be on, should be on horizontal level of, horizontal level of opening of ears, opening of ears, right? Okay. And this palm should face front, right? The palm, and the toe pointing forward, toe pointing forward. Okay. Yeah, that's all. This is the anatomical position. Okay. So eyes are open, hands are on the side, palm is on the front, legs are together, toe pointing forward. Neutral facial expression, lower bit of the eye should be on the horizontal level of the opening of the ear. Okay, right. This was about the anatomical position. Okay. After anatomical position, now let us see the planes dissecting the body. Like there are basically three planes. Of course, there are three planes like vertical planes, horizontal plane, right? And even in the vertical, because our body is like 3D object, we need to consider two planes. So what are these planes? Coronal planes, coronal plane, sagittal plane, transverse, okay, transverse, axial, or horizontal plane, horizontal plane. These planes are nothing but just like, okay, this is the body, right? Suppose this is let us say this is the coronal plane. If this is the coronal plane, like it divides the body, it divides the body, the anterior and the posterior part. Okay, you got it right. This plane, okay, let me take my hand at the coronal plane. This plane is like dividing the body, dividing the body into the anterior part and the posterior part. And this sagittal plane is like from this way, dividing the body into right and the left side. And of course, this, if this is coronal plane and this is sagittal plane, these things are right angle to each other, right? Okay, these things. And the transverse axial or horizontal plane is like all of us know horizontal plane, right? And this divide the body into superior and inferior part. Okay, let me write it. Coronal plane. Plane is oriented vertically, right? Vertically, and divide the body into anterior and posterior part. Okay, here we get the mnemonics, right? C, A, and C, P. So we get the mnemonics like C, A, P cap, coronal plane, divide the body into anterior and the posterior part. Okay. Now let's go to the sagittal plane. Sagittal plane is the plane which is also oriented vertically. But how is it different? How it is different from the coronal plane? It is perpendicular to coronal plane and divide the body into right and left halves. Okay, right and left halves. Okay, it's better we say parts, right? It's better we say parts because the sagittal plane dividing the body into equal parts, like right and left halves, like right and left equal parts, it's called medial sagittal plane. We have got another name for it. Okay, let me write it here. Median sagittal plane divides the body into equal right and left parts. Okay. Now transverse axial or horizontal plane. Its name says it clearly. It's oriented horizontally and divide the body into superior and inferior parts. Okay. This was introduction to the anatomy, this simple beginning, right? From our next episode, I will be discussing the names of the bone. I will just be listing the bones, right? For today, thank you very much. I hope you enjoy my lecture anyway. Anatomy is not that boring topic. We'll see next time. Thank you very much.